adopted by the United Nations General Assembly in 1989, provides that states parties to the convention recognize the right of the child to the enjoyment of the highest standard of health, close quote. Now, the reason I'm raising this part as important today is because it speaks directly to the theme of today, urging governments to protect young people from continuously being targeted by the tobacco industry. But also, the importance of today is for governments to act and to act now, because otherwise, DM, if we allow the industry, there's no monitoring, what's going to happen to the youth of South Africa? The young person next to me, Sam, has already indicated the plea from the young people of South Africa, the tobacco generation. Now, we are deeply concerned as part of seems to be acting willingly. We do know we have a very responsible existing tobacco control. Congratulate our President Magdamela Cyril Ramaphosa, and the entire leadership of this department for ensuring that the bill that seeks to amend the existing legislation and close those loopholes that have been exploited by the industry is strengthened. Some progress has been made, and we are hoping, DM, that there's going to be more speed to ensure that the bill is passed. Because without this bill, which puts measures that are strong, measures that will protect the youth, measures that will protect women, measures that will protect the elderly, measures that will protect any other South African, even the smokers themselves. We believe the bill will protect even the smokers themselves. I mean, we hear smokers say they are left out in the lurches. No, we keep telling them the bill and every tobacco control measure aims to protect both smokers and non-smokers because of the dangers, because the dangers do not only occur on the smokers, they occur on the non-smokers as well. Now, moving further, I have no doubt in my mind, the previous speaker has indicated that the novel tobacco products that we are seeing now, your IQOS, your Juul, and so on, flavored, you even have the juices, your non-nicotine products that do not need you to ignite. They use certain devices to get them heated. All those products, the claims by the tobacco industry, the world over, we know the industry claims that these are less harmful. The young person next to me has indicated less harm doesn't mean no harm, because the long-term effect hasn't been established. And so when the tobacco industry keeps harmful, we question that. But also, I think I must hasten to say, leadership, that the young people that get exposed to these products, there are various reasons why. Some of them is purely because of ignorance. Some they do know, or maybe they just do not believe that these tobacco products are harmful. And others, of course, is because of the tactics of the tobacco industry to lure them into smoking. Because the issue with tobacco industry, they want to ensure that they keep the value chain live. As people grow older into smoking and die, the tobacco industry want to ensure that young people join the value chain so that by the time that same group reach the tail end of the value chain, there's a new one. So they want to ensure that they keep profiting in whatever means and whatever time. Right now, we read during this period of COVID-19 that in countries like Spain and Italy, the industry has done things that can never be imagined. They've really stooped very low this time. promoting their product. Even people are getting sick, young people into smoke. And we read again that as they use social media, now they've gotten into the habit of ensuring that some of their products that are advertised online, they give this. If you buy a certain, say you buy Jewel or whatever, then you get a face mask free. And the face mask is branded, the name of the company. And what on earth would you call that? Is that a responsible industry? They always claim they are a responsible industry. Excuse me, I beg to differ. That is not responsibility. It's far from it. It's really far from it. And so, DM, as we sit here today, engaging in this platform, we do want, as it's been said, to plead with the department to ensure that this bill that we have, because as civil society, we're doing our best to support, we're doing our best to educate the public, but it's not enough if the bill is not And so as we sit here to speak, and ubantu ugwayi lo ongewona lo gwayi ujawulekile ufikile ivapor. And mangabe lezi inkampani zikagwayi zikhuluma zidlala ngani, zintshela ukuthi lezi inhlobo zikagwayi azina angeze nibangela izifo. Zizela nje benzela ukuthi mina niqhube uthole iprofit ngeimpilo zenu. Angeke kwenzeke lokho. So into esishoyo ke namhlanje ukuthi wena muntu omusha ekhaya la uhlezi khona, siyazi ukuthi nani ninamalungelo, ninama choices enu njengoba nisho. Young people, you keep telling us about your choices, about your rights. Yes, fair enough, we understand that. But remember, as you engage in that practice, as you engage in that behavior, make sure that you know what you're doing. And our concern is that most of you young people do not know what you are doing. You just get into these behaviors which will harm your health. Because to speak the honest truth, there is no benefit of smoking. There is no benefit of using tobacco. Instead, what happens? It harms your health. It harms the economy. Why? Because as people smoke, get sick, they complicate, they go to hospital. When they go to hospital, government has to treat them. What does that do? It depletes the health budget, the money which government needs to do so many other things within the health system. And so therefore, we are throwing caution today to the young people that is, open your eyes. Social media, yes, it's good to be on social media, but you don't have to follow everything and buy everything that you see on social media. You have everything, the information is available all over. You have to make a choice, take a step back, make a choice, and decide about your life, about your future. Bantabasha, i-choice ikunina, zikhetheleni, ima, udecide, uqaphele ukuthi wenzani, ukuze uvikele impilo yakho. Now, and lastly, I need to say, to thank the department for inviting us. And as civil society, wherever we are, whoever we are, we want to join forces with government in this fight against tobacco, because it's not only a fight for now, it's a fight for years to come. We're fighting for the future generation. We're fighting for people that are still even not born right now as we speak. So let us remember, a healthy nation is a rich nation. Thank you.
Thank you. Civil society has spoken. We are getting support from our civil society against this fight, making sure that we end up with a tobacco-free generation. We will now have our Deputy Minister speaking, talking to us, talking to you, talking to the nation about the dangers of tobacco. I hope you are ready. We have had various messages today. If you didn't hear, then I'm worried. Are you ready for Deputy Minister?
Thank you very much,
Thank you, dear.
Program Director, Lynn Moeng Mahlangu, to the colleagues here. I know that Dr. Kalua is online, is going to also give us a message. To all the participants from civil society, our partners in the media, thank you very much for being with us on this very important day when we celebrate the World No Tobacco Day, this 31st of May 2020. The aim of having this activity today as we celebrate the No Tobacco Day is to remind smokers, young people and non-smokers about the risk of using and exposure to tobacco products, and to strengthen our resolve and our fight against the use of tobacco. The theme for World No Tobacco Day in today, 2020, is protecting youth from industry manipulation and preventing them from tobacco and nicotine use. Specifically for South Africa, we also like to enlighten the public about the risk of smoking during this COVID-19 pandemic. We know that this has been a very topical issue, a lot of debate and controversy, but we want to assert that indeed we believe the decision to disallow retailing of tobacco was and remains a correct one. Tobacco use is a leading risk factor for death, killing half of those who smoke. As already mentioned by the professor before me, 8 million deaths a year globally, 1.2 million of those being what we call passive smokers, who inhale the tobacco, the nicotine, not out of choice. In South Africa currently, we have made a lot of progress, because a few years ago, the tobacco used to kill about 40,000 people upwards, but through the various efforts of government and also civil society, this figure has come down to about 20,000 a year. But it still leaves many people with a debilitating chronic obstructive airway disease. Tobacco is a risk factor also in the coronary heart disease, leading to what we commonly call heart attacks, when the arteries supplying blood to the heart get blocked. This is a direct contribution by smoking. I must also just add that not only the arteries to the heart, but it also leads to obstruction of other blood vessels, resulting in many cases also in people suffering what is called peripheral vascular disease, which result in gangrene in the limbs, both in the arms and also in the legs. During my time as a practicing physician, I've seen young people and older people having to have amputation of the arms and the legs as the result of smoking. And the sad part is that I've seen many of them who, even during that time of amputation, in our surgery class, I remember one of our professors used to tell us a story of somebody who had this peripheral vascular disease in the arms, and so they have to chop fingers until they chop their hands. He continued smoking until when he remained with the stumps and used to hold a cigarette like this and smoke when even the hands were gone. So that's how serious it is and how addictive. It also causes several types of cancers, amongst them well-known lung cancer, also contribute to a host of other diseases, such as strokes, kidney disease, peptic ulcers, and also predisposes those damaged lungs to more severe form of tuberculosis once the bacterium of tuberculosis can land on damaged land by cigarettes. Tobacco kills half of those by 10 years. Last be puffing and difficulty in breathing over the last years until the life is terminated. South Africa has a proud history in tobacco control, as already mentioned by some of the colleagues, through legislation from the early 90s. Over time, measures such as banning tobacco advertising, prohibiting smoking in public places, long before even this became dominant throughout the world, we were one of the leaders in prohibiting smoking in public places, and also progressively increasing the tax on cigarettes, resulting in reducing smokers over the last 15 years from 32% of adult population in 1992 to only 18.2% in 2012. During this period, there was a serious decline in lung cancer deaths reported. The 2016 South African Demographic Health Survey, already mentioned by the professor earlier on, reported a slight increase in smoking prevalence from the 18.2 to about 21%, which is a worry, and therefore what Zanele mentioned here, that we need to add more on the instruments to discourage the use of tobacco becomes relevant. This increase is a concern, and therefore we need to strengthen education, as in those columns, health education. As you may be asking, while we have been to protect the public from harmful effects of tobacco use, we continue to identify areas that need more strengthening through legislation, hence this bill, which seeks to address, amongst others, some of the areas which are not yet covered. We want a change from the 25% currently allowed smoking in public areas to 100% prohibition of smoking indoor in public areas. So this is what this bill aims to protect non-smokers. We've already mentioned that up to over 1 million non-smokers die from passive smoking. The regulation of the electronic delivery systems and related products, we want to bring them into the fold so that they can also be controlled. South Africa is one of the earliest countries to protect children from tobacco through banning the sale of cigarettes to minors, banning advertising, promotion, and sponsorship of sporting and social events by tobacco companies, and prohibiting smoking in a car where there are children under the age of 12. We've made a lot of progress in this regard. It was unimaginable previously when many sporting activities benefited from tobacco sponsorship, and people thought sports would collapse. But we have seen that indeed other industries came into replace, and now it's normal that we don't have any tobacco sponsors. Which takes me to the other, which is not for today, to say even the fear about the other enemy, which is alcohol. It means, in fact, the fear that removing it from sponsorship will collapse sports. It's actually not true. We have this background that it can be done. South Africa was also at the forefront of global efforts to control tobacco use and was amongst the lead countries in the international negotiations of the Framework Convention on Tobacco Control, already referred to. The FTC is evidence-based public health treaty negotiated under the auspices of the WHO, the World Health Organization, from 2000 to 2003. This treaty reaffirms standard of health and fighting and obvious espoused in this treaty. The FTC was the first global treaty negotiated under the WHO. In our upcoming bill, South Africa is taking action, as I've mentioned, against electronic cigarette and vaping, and treats e-cigarette liquids and classifies this as tobacco products. We acknowledge that this is an area that, as a country, we strongly need to monitor. We need to do more research and regulate based on lessons from other countries. We know that there's been a lot of literature from the United States of America, which has seen quite a number of thousands of young Americans, teenagers, becoming addicted to nicotine, possibly for life. Following their initiation and the East. It looks very much modern in products themselves. There's evidence that they cause a lot of damage. Though they have less risk of causing cancer, they do have other harmful effects on the lungs. It is reported that scores of American teenagers are dying from inflammatory lung conditions following the use of this vaping and e-cigarettes. Research presented at the American College of Cardiology meeting that the e-cigarette increased the chances of having heart attack by 56%, increases the chances of a stroke by 30%. E-cigarettes also serve as a gateway for teenagers to take up smoking, as I've mentioned, and end up, but even though they might have a smaller amount of nicotine, but that is still very addictive, and it gets them ultimately to want to get higher and higher levels of nicotine, and end up being introduced into the full-blown cigarette smoking. It is for this reason that the tobacco industry is focusing on young people. As a government, we have the responsibility to equip our young people with the knowledge about the dangers of using tobacco and nicotine products, including tactics used by the industry to lure them into getting into this habit. Some of this include the use of celebrities, as already mentioned, influencers through sleek designs, attractive and various flavors, and also marketing this having no harm. To get this a message that I would like to send to our young people today as we celebrate this World No Tobacco Day. There are approximately 20% of adults who do smoke. The recent period already Zanele has mentioned that during this lockdown period, many of them, 800,000, have already been able to quit smoking, which is very commendable, and we hope that they will remain non-smokers. The risk of lung cancer, heart attacks, and other diseases caused by tobacco decreases successively cessation of as you add more and more years, your health improves more and more. And after 20 years, an ex-smoker has no greater risk of lung cancer than someone who never smoked. So indeed, as much as there is damage, but the lung is able to regenerate once every year you stop smoking. And after 20 years of stopping, there's absolutely nothing to show. And I can speak from experience. I'm one of those who was lured during my teenage years at boarding school to smoke. and I stopped about 30 years ago. And so just today, I will not even show that some 30 years ago I was a smoker. This is particularly important as emerging evidence shows that smokers and those using the products such as water pipes and bubbly are more likely to suffer more severe effects of this COVID-19. People who have never smoked need to be on ventilators, no doubt, had they get caught with the COVID-19. And those who do not smoke. In South Africa, earlier on, age is between 15 and 20 years of introduction. Comprehensive and intersectoral tobacco control health promotion strategies implemented in our country, led by our government, has led to a gradual reduction in cigarette use amongst school learners, up to 25% reduction between 1996 and 2011. So we must continue to do this education so that we can win off and prevent many more young people from even being inducted into smoking. Our action against electronic cigarette is consonant with the World No Tobacco Day as we celebrate today, resisting the efforts of the tobacco industry to addict our children to nicotine contained in various delivery systems, so that they may become sick. They may become, once they get introduced to this, they will then become cigarette smokers. So what we are doing here today is to prevent that. We should redouble our efforts to resist this, to addict our children, and to make huge amounts of money out of the death and suffering of over 8 million people in the world. Prevention of tobacco use and stopping smoking have many benefits. They largely eliminate the risk of cancer, as we've mentioned, reduce the risk of many other diseases, other cancers, including cancer of the mouth, cancer of the esophagus, and also in the upper respiratory system, in the pharynx. All those cancers can be reduced and eliminated by not smoking. Avoiding or stopping smoking removes the risk of chronic obstructive airway disease. And in those who are smoking, who already have some introduction of chronic obstructive airway disease, they have a good opportunity to actually, heal and get better health. Avoidance and quitting also dramatically reduces the chances of heart attack, the possibility of finding yourself in hospital, even if you have other diseases like asthma. So indeed, we are here today to say avoiding or quitting tobacco use relieves also poverty, because so much, we know that in other studies over this period, some of the antagonists have been arguing that by prohibiting the sale of cigarettes, we are promoting illicit cigarettes, and people are prepared to spend even double or treble the amount. So that, in fact, that's why we really want to congratulate those who saw it as an opportunity to stop, because it also means that they are better off today to look after themselves economically and look after their families, because instead of being tempted into spending lots and lots of money, they now can feed their families, clothe their families, and make sure that they've got all the essential goods. So indeed, as I end, I want to say that we see this day of the World No Tobacco Day as a very important day for us to promote healthy lifestyle amongst our people, to protect our children, and also to make sure that those who were almost getting tempted into introduction to these more sophisticated new products, that they must get a message that this is the time. If you are already getting tempted, to just stop and think and say no to cigarettes, to e-cigarette, to vaping, and make sure that you can indeed have a long and healthy life for you, but also for your family and your neighbors. Because as you smoke, as we have said, up to more than 1 million people who have never smoked themselves but end up being affected. So thank you very much. And indeed, we hope that the message, and we thank the media for being here. We hope that the message will really go down, especially to our young people, that this is not cool. Don't go into cigarette smoking. Thank you very much.
Thank you all for listening. Whilst we are trying to connect WHO to the laptop, can we just focus on what's on the screen? There's a graffiti artist, Masumo J, who's trying to, not trying, because he knows what he's doing, who's drawing a graffiti picture for World Tobacco Day. Maybe the lights are, we can't remove them, but it's, whilst they are trying to connect them, we can at least concentrate on that. He's using
Right, it seems that we lost connection. It's just a pity because we had this bad connection with the Deputy Health Minister, Dr. Joe Phaahla. We'll try to, well, we're getting this feed, so it's not in our hands. So we will try to make sure that it is as stable as possible if we can. But just to recap on what this is all about, the National Department of Health marking World No Tobacco Day with a high-level virtual dialogue with scientists, civil society and the media, hosted by the Minister of Health, Dr. Zweli Mkhize. You heard from the Deputy Minister of Health there. This event is marked globally to increase awareness on the effects of tobacco and nicotine products on human health. And we heard from Deputy Minister, Health Minister, Dr. Joe Phaahla, talking about the various issues with regards to smoking. And the WHO actually tells us that tobacco kills more than 8 million people globally every year. More than 7 million of these deaths are from direct tobacco use, and around 1.2 million are due to non-smokers being exposed to secondhand smoke. With regards to quitting, again, the World Health Organization tells us that within 20 minutes of quitting, elevated heart rate and blood pressure drops. After 12 hours, the carbon monoxide level in the bloodstream drops to normal. Within 2 to 12 weeks, circulation improves and lung function increases. And after 1 to 9 months, coughing and shortness of breath decreases. This is the information that we got from the World Health Organization. So we're bound to hear much more on World No Tobacco Day. I think the Minister of Health, Dr. Zweli Mkhize, is also scheduled to address this virtual briefing. So we'll work on that connection. When we do have it, we'll get you that details live. We're going to take a short break. We'll get you more news next. Stay with us. Joe Pasla. We're expecting to hear from the Health Minister as well, Dr. Zweli Mkhize. It's with regards to marking this day globally to bring about an increased awareness of the effects of tobacco and nicotine products on human health. Let's go there now live.
All forms of tobacco use are harmful, and there is no safe level of exposure to second-hand smoke. E-cigarette use increases the risk of heart disease and lung disorders, and the nicotine in these products can impact brain development in children. Smoking shisha is as harmful as other forms of tobacco use, and chewing tobacco can cause mouth cancer, tooth loss, and gum disease. In the Africa region, 94 million men and 13 million women and 1 in 5 adolescents use tobacco products. Tobacco use is increasing among 13 to 15-year-old girls, and the use of tobacco products other than cigarettes is increasing in the Africa region. And every year, 146,000 Africans die from tobacco-related diseases. Illness related to tobacco use accounts for 3.5% of annual total health expenditure in the Africa region. Distinguished colleagues, ladies and gentlemen, to combat tobacco-related illness and death, 26 African countries have banned smoking in public places. And among them, 10 have implemented comprehensive bans. 34 countries have banned tobacco advertising, promotion, and sponsorship. However, in trying to protect their citizens, many governments are being confronted with industry threats and legal action to weaken these measures that control tobacco use. And to support member states to counter tobacco industry interference, the World Health Organization will continue working with partners to debunk myths, expose manipulative tactics, and strengthen health policies. Today, as we observe the World No Tobacco Day, we call on all young people to join the fight against the tobacco epidemic. We encourage youth groups to build a movement for a tobacco-free generation. We urge celebrities and influencers to reject all forms of tobacco industry sponsorship. We are calling upon parents, caregivers, and teachers to educate children on the harms of tobacco product use and advocate for 100% smoke-free public places and banning all forms of tobacco advertising. Finally, the World Health Organization urges all governments to implement comprehensive tobacco control policies as outlined in the WHO Framework Convention on Tobacco Control in order to save lives and reduce healthcare costs. With international solidarity, young people can lead the way by becoming the first tobacco-free generation. You can count on the World Health Organization to continue to be a key partner in stopping the epidemic of tobacco use. I thank you.
Thank you, sir. Are you still available for questions, Dr. Kulua?
Yes, I'm around.
All right, it seems that we once again lost audio here. To this link to this virtual briefing is a bit unstable. The National Department of Health marking World No Tobacco Day with a high-level virtual dialogue with government, scientists, civil society, and the media. And this event is marked globally to increase awareness on the effects of tobacco and nicotine products to human health. We'll try and work on the connection. When we do have that, we will bring it to you live. Do we have that connection up and running, Michael? No, we don't? All right. Let's take a quick break. Day with a high-level virtual dialogue, including government, scientists, civil society, as well as the media. There is going to be a question and answer session now. Let's go there now live.
It looks like it's essentially about
of the employees. Doc, did you get Dr. Kalu, did you get the question?
Hello? I got just part of the question.
While
I just got...
the question is the question is mainly about the casino industry, where the employers, they only care about maximizing the profit at the expense of vulnerable healthcare workers. So they want to know the view of the panelists. What's your view on that?
Okay, my view is that every effort should be made to avoid exposure to tobacco. Because, as I said earlier on, there's no safe level of tobacco exposure, whether one is smoking themselves or whether one is inhaling second-hand tobacco smoke. So it's very important that all workplaces should put in place measures and mechanisms that will ensure that there is no undue exposure to tobacco smoke, which, as we say, there's no safe level for it, and therefore it's harmful to health. Thank you.
Thanks, Doc.
It is such an important topic to be discussing, but unfortunately, the connection to the Zoom, I'm not sure if it's Zoom, it's this virtual meeting, it's not stable at all. We will try our best to reconnect. If not, we will bring you some of the bigger takeaways a little later on. We've heard from the Deputy Health Minister there, Dr. Joe Phaahla, earlier on talking about the dangers of smoking. And when we read some statements from the WHO, it tells us that tobacco kills more than 8 million people globally every year, and more than 7 million of these deaths are from direct tobacco use, and around 1.2 million are due to non-smokers being exposed to secondhand smoke. And with regards to quitting, again, the WHO organization tells us that within 20 minutes of quitting, elevated heart rate and blood pressure drops. After 12 hours, the carbon monoxide level in the bloodstream drops to normal. Within 2 to 12 weeks, circulation improves and lung function increases. And after 1 to 2 months, coughing and shortness of breath decreases. That's according to a recent statement by the WHO, the World Health Organization. All right, we're going to take a quick break. When we come back, I'll get you more news. Stay with us.